Welcome to Cerner's live experience at HIMSS 2019 in Orlando, Florida. We are streaming live from the Cerner recording studio on the HIMSS exhibit floor, where we're sharing unique and insightful perspectives from some of the brightest minds in healthcare. At Cerner, we are intent on becoming the partner of choice for innovation in healthcare. But innovation only happens through collaboration. We are at a place of immense opportunity and possibility in this industry, but our next chapter can only be as powerful as the collaborative relationships that we cultivate. Today, we're discussing the drivers for health systems to be successful in value-based care, whether through or launching their own plan. We're joined in the studio Population Health Accountable Care Strategy at Cerner, and our guest, Matt Cox, Chief Marketing Officer at Lumeris. Ray and Matt, thank you for joining us today.
Matt, thanks for sitting down, having a conversation with me today. Let's jump right in.
Yeah, I'm happy to.
All right, so let's level set for the audience. Do you mind giving an overview of value-based care and what spurred this trending topic in the industry today?
Yeah, I think probably the number one reason that we are seeing a huge uplift in value-based care interest right now today is that the status quo is unsustainable, right? When we cannot keep a fee-for-service environment with the increases in spend around healthcare, and so something's got to change. So at its simplest, I think value-based care, means delivering lower costs but at better outcomes, and it's a massive transformation in order for us to get from a volume-based care environment into a value-based care environment. I'm excited about it. I really am. I'd also like to point out I'm a little concerned that the industry is using the term value-based care to mean a way to put in lower costs and less costs, less reimbursement, and I don't think that's the case. I think there's enough benefit in the opportunities to reduce waste and still reward providers financially, health systems, and improve what we're doing with patients and members.
Terrific. So tell me this, value-based care models are placing increased responsibility on providers. They're taking financial risk. They're also, responsible for improving the quality of care. How does Lumeris see this impacting providers' role in healthcare overall?
Yeah, that's a great question, Ray. So I think one of the issues that we're facing right now today is that provider burnouts is it's funny. I feel like we keep saying this. It's at an all-time high. We got to be really sensitive to what's going on with the providers, with how we design and plans and authorizations and their pay-per-performance metrics, and I really think that technology plays a really important role here, right? So when I think about something like Cerner and sort of the new innovative things that Cerner's doing with an eye towards how do we pay attention to delivering better outcomes, but higher quality at lower cost, but at the same point in time too, how do we think about this impact on the provider? And I think that's going to be critically important. In order for us to get adoption for value-based care, there's so many different things we have to pay attention to, but one of the things that we have to pay attention to outside of aligning incentives so that it's meaningful for providers when they practice value-based care, when they focus on outcomes, is we also have got to reduce some of the burden that's happening because it's a challenge for doctors.
Sure. And you touched on the interesting dynamic of how the providers are going to have to change, how technology can make it easier and programmable and more systematic in the way they do change management. But tell me about how this is also changing the relationship between the payers and the providers and how that has to evolve as well.
Yeah, we often talk about at Lumeris, we talk about a collaborative payer model. And actually a collaborative payer-provider model. And fundamental to a collaborative payer-provider model is this issue around transparency. We have to have a sharing of the economics and the opportunities relative to building trust Because if we don't have trust there, how do we get into these partnerships? How do we focus on patients and outcomes? How do we focus on those larger opportunities, those initiatives, and cutting waste out? Because one person's waste is another person's profit, right? And that's a problem. We have to align to incentives that skate to this greater opportunity. And I think there's multiple different ways to do the collaborative payer model in areas, but there's also ways to do it wrong. And showing the roadmap on how they can get there, and bringing the provider into this, bringing the health system in, bringing, and partnering with folks like Cerner in order to skate towards these outcomes is going to be critically important.
Now that's really insightful. I think that historically the payer-provider relationship has been adversarial by design. The payer looks at medical expense, they call it their medical loss ratio. Like every time somebody gets care, that's a loss.
Right.
And the provider saying, wait, that's my revenue, and so that inherently has been in conflict. So this idea of a collaborative payer and how that alignment of incentives, really will make a significant difference in how, both sides behave. So
you know what, I got to tell you, so that issue of medical loss ratio is a, in my view, to what you were saying, I don't need to capitalize on that, but it's an antiquated concept, right? It's a medical cost ratio, right? What's the cost of providing the services so that we can then focus on the surplus and the outcomes and the things that have got to happen, right? I'm glad you brought that up. That's important.
Yeah. And I think, one of the things that, if you could kind of go into that next level, talk about how our organizations are working together to help health systems succeed in value-based care, how our collaboration will help enhance financial and clinical outcomes for our clients, for our joint clients.
Yeah, no, it's we operate today a platform that we have done so successfully for 10 years. It's a great platform, but as in all things, it's got to evolve, right? As we began looking at our roadmap for what the next generation platform needed to be, it was clear in discussions with Cerner that not only did Cerner's platform align really well with some of our contemporary thinking and planning around product and platform and technology, but it actually took it even a step further. And I think anybody in charge of product and marketing and strategy is going to look at that and say, boy, why do I feel the need to build something that already exists in the market, and by a company that's EHR agnostic, right? That has a view of the world that's open, right? Because this idea that we have a closed systems is that's not sustainable. That's not going to work, right? We have to have a partner that not only can provide us with a platform and the ability to scale, but also that has an open culture and mindset about how do we see the future of healthcare. And Cerner had that with I think you guys had the Commonwealth Health Alliance, right?
Yep.
Didn't you lead that, or one of the founders?
Yes. That was the idea that if we could collaborate as an industry around how to create interoperability standards, how to responsibly share data. The government has given a push in that, but I think industry has also been pretty active in Cerner's entire strategy around population health and helping providers take on risk is that there has to be liquidity of data and information. It isn't just the data, but what are the insights and derived information from that data that needs to be distributed and used by the providers in order to improve care. Well,
I think that capitalizes on this morning's opening with Seema Verma and Levitt and some of the others, DeSalvo, that were basically saying, look, we instituted this 10 years ago, right? And it's really incumbent upon us in the industry to embrace it and really jump on it. And that's going to be really important. What we bring to the table to the Maestro opportunity is we've operated a plan, right? We operate a plan today with a 70% MLR. Which is typically, or I was MCR.
MCR, medical cost ratio.
I can't get out of the mindset of saying it. You put it in my head. But, so we get We operate, and that's a 26% savings to the Medicare program. And how can we do more of that and bring that collaborative payer-provider model to the market so that these health systems, that these provider organizations, and for that matter, if we could find a collaborative payer, deliver this thing to the market so that we can cut out waste and improve the system.
Yeah, that was a big driver for Cerner's interest in partnering with Lumeris, is that you had not only economic success and you were able to demonstrate that you could scale it and repeat it, but also that when you achieve that high performance, that medical cost ratio, that flowed back to the providers who were doing the work to improve that performance. It flows back to the beneficiaries in the form of extended or enhanced benefits, and it's a sustainable model. And so I think that's, for all of our clients across the country that are taking this on, I think that there's, as you said, it doesn't mean you have to just lower unit price. There is plenty of reimbursement to go around if, in fact, we optimize the way we proactively take care of people.
Yeah.
So this is terrific. Let's talk about this. What are some of the lessons learned from providers taking on risk contracts or launching their own plans that you could reflect on?
Yeah, I often say I learn a lot from my successes, but I learn a lot more from my failures.
Right.
My dad would be really proud of me saying that.
Right.
Because he's saying I told you so.
Right.
So, the incentives have got to be right? They've got to be aligned across. They can't be overly weighted one way or the other. They can't be overly weighted towards the health system and not enough towards the primary care providers. They have to bring in some value and benefit for the specialists, right? That somebody needs to monitor and manage the plan performance and make sure that the initial targets are set appropriately, that the plan achieves performance on multiple levels, and that's that. Having a collaborative payer comes in with that level of transparency and involves like we involve providers in benefits design, right? Mm-hmm. What makes the most sense? We get user group feedback on what benefits they think actually are important to them, and we try and bring that to the providers and bring that to the plan level. You got to be able to get the data. You got to be able to aggregate it. You got to normalize and transform it. You know this better than I do, right? I mean,
got no hair because of that.
Yeah, right. Well, must be contagious. So you got to, so you got to take this data. You got to normalize and transform it in a way that's meaningful, that the providers trust, right? And so this trust around the data is critically important, especially early on, right? The providers we're asking them to make value-based care judgments based on the data. The data needs to be right. And you know more than most, right? How important that is. And then, I think getting in the workflow is another major area, right? Go back to my earlier comment about, physician burnout, right? What we can't do is ask them, and by them being the care managers, the population health managers, the medical directors, the physicians, we can't ask them to key stuff in that's not value add. Mm-hmm. That's really disappointing, to be doing that work and not feel like you're getting rewarded for it and not feeling like it's actually making a difference, right? And so we got to be in the workflow, and that was also one of the things that we like about Cerner and Healthy Intent, and the idea that we can leverage open APIs. It's going to be critically important.
Yeah, but I'll add on a little bit in that you've covered a lot of the kind of the important parts of a risk contract, of how the data is shared, how it's integrated, how it's timely, how it's complete. How are those contracts fair and balanced so that there's alignment. I think the thing that in my past life and your past life, it's hard enough to own a health system and operate a health system, to also then start out and think about owning your own insurance company. That's a different business. It's a related business, but it has a lot of different regulatory requirements, operational requirements. Scale matters in that business because of the technology burden that the bigger health plans have. So I think one of the things that is pretty exciting about our partnership is Cerner brings a scale and a huge capital budget towards forward-looking technology, and you guys have the expertise on helping health systems that want to run their own plan, to how to optimize those operations as well. So very important.
You actually brought up something else that I think is critically important that we're not thinking or talking about enough, which is how do we use this technology in the same way other industries have used technology to improve the customer experience. And whether that's a CRM, you obviously got the Salesforce piece of it. But if in healthcare, right, if you said CRM to a provider's practice, they have no idea what you're talking about, right? They don't think in terms of customer relationship management, right? I have patients,
right?
But we need to be thinking about those when you're operating a plan, and not just like a plan today, but the plan of the future.
Correct.
You know what I mean?
Yes, 100%. And what's exciting, I think, also is I know that this was part of the keynote this morning, that it's been about 10 years since the High-Tech Act, and we went from 22% of the U.S. to 98% of the U.S. is now electronic. So that's progress, right?
No, that's good.
Not as fast as people would like, but in real terms, that's progress. I think the next 10 years, I think we're going to see huge amount of innovation and transformation in the way both patient and provider engagement works, both from a health plan perspective and a provider delivery system perspective. Very exciting, very exciting. We're going to do that together. Why is now the time for providers to embrace value-based care?
Wow. I mean, go back to what I said when we started out, right? We're on this, we're way past being in a sustainable spend of healthcare in this country right now today. I reflect back on some recent experience that I had at a conference a week or so ago, and there was some good data out there showing that not only are you operating Medicaid business at a loss, you're starting to operate your Medicare business at a loss. We used to say Medicare was break even, but since 2015, 2016, with no increase in reimbursements, right? You've got to change doing what you're doing. You got to move to a value-based care model. You got to start taking premium. You got to start taking risk. We don't normally think about those things as a health system. With my past life at Duke or working with large health systems, risk was a dirty word. Right? I mean, we don't take risk. Now you got to take risk, and you can't just do it incrementally. You've got to embrace these models. They're long-term bets, but there's proven success, and so have faith and comfort that there are successful models out there. There's a good way to do this. You got to get your documentation coding right. You do that, and you got to partner with somebody that knows what they're doing.
Right.
Taking risk.
Yeah, it's risky.
Be a problem, right? Yeah, it's risky.
Yeah, it's totally rational.
Wow,
I want to take
that was pretty insightful, wasn't it?
That's good.
Yeah. Take a risk. Woo.
Yeah. No. Well, thanks, Matt. I think we really appreciate the opportunity to talk with you today and to work with you. And I think for the health systems and others out there that are knowing that this kind of transformation is inevitable. Key part that you said in the last point there was you got to pick the right partners. And they got to be willing to get in there and take risks with you and get their incentives aligned, so they're not just pushing product and billable hours and selling technology, but that the economics of that relationship with those provider communities is aligned, so that we're in there with our clients, with our customers, to get the same outcomes that they want. So.
I appreciate that. I appreciate you taking the time to give me a platform here to talk about something I'm really passionate about. I know you're passionate about it too.
You got it.
One last question for you.
Sure.
Baker Mayfield.
Yeah, go Browns.
Yeah, is that right?
You got it.
All right.
All right. Thank you, Matt.
Yeah, you got it.